So Amicus FLAGs is a tool that connects risky pregnancies to financial support and special care. So risky pregnancy can be identified based on so many things. So we are looking at anything that puts the life of the mother or that of the baby at risk. That is a risky pregnancy, and it could span from symptoms, it could be asymptomatic or very, very clear symptoms, or even clinical. So even stress levels. So all those things are things that can be considered to be placing the wellness of the expectant mother or the unborn baby at risk. So I will quickly walk you through the interface. A doctor, upon registration and configuration, would ideally come and log in. And upon logging in, they will view their conversations with their patients, as well as the dashboard with a couple of flags, as well as the revenue generated. So remember, when you're onboarding as a doctor, you have a personalized chatbot that your patients or clients or prospective clients interact with. So when you log in, you get to see the conversations of your customers and your clients, and you could respond to any one of them. And this would go directly to their inbox. Yeah. So this is well noted. So their WhatsApp, when you reply from this platform, they get to see a message from their own WhatsApp. So this is a list of all the possible customers who have interacted with Dr. Jerry, who's a pharmacist and specializes in fertility and vaginal health. So when you come to flags is where the magic happens. So there are several conditions that could be at risk to any patient. One of the conditions would be preeclampsia, another one mental health, family planning and fertility. For those people who have given birth, close birth have a risk of subsequent birth. So there is need for family planning. And for those people who want to understand how to get a boy, a girl, twins, all those discussions. So there are several questions that are normally sent to the patient through your chatbot as a doctor. Your doctor triggers questions to your clients, and based on the answers, their risk level is predicted. And if you are high risk, these are prospective clients who needs more attention, probably a consultation to your office, a physical visit, or a telephone conversation. So, giving this as an example, we have 121 total users in the platform under Dr. Raisha, and 79 have taken the risk classification questions, and the high risk have been identified to be 9, medium risk to be 24, and low risk to be 46. And these are from yesterday, 9, 19, and 16 respectively. So that is the first glance of your patients that you can now drill down to get the idea. And since this is also generating revenue through your chat consultancy, you are generating revenue the more advocacy you do through your chatbot and you educate them. So this is generated revenue since Monday, and message counts. So there are some messages that generate revenue, there are some that do not generate revenue. Revenue is a discussion between us and the patient and the doctor, sorry. And out of those who have chatted, how many are new, how many have been flagged as high risk, how many have been flagged as medium risk, and how many have been flagged as risk. So you look at the conversation and who have been flagged at what point. Now, because you're providing financial connection to support, these are budgeted items, and based on the overall revenue generated historically and the budgeted, revenue supported. So patient goes to Daktari, and Daktari identify this is high risk. The patient is not able to finance. Then we connect to faith-based organization who have access to the same system and can approve financing based on the risk level and their determination. So if you want to see high-risk patients who've been flagged, that is where you see them. You can make a call, you can send an SMS, you can send an email, or view their details. When they come to you at your clinic for appointments, they can also you can also update the system with now the clinical vitals. So that's it for now, and this is progressive, and yeah, that marks the end.